If you struggle with shyness or social anxiety, check out our free No BS training course with actual useful advice you can do from home. None of that just get out there nonsense. The link is in the description below. For now, let's get to today's question.
There is a reason I'm not a fan of daily anxiety medications. Several actually, but other than the side effects, I firmly believe behavioral retraining is far more effective. However, there are daily anxiety medications if you go down that path. The medication your doctor prescribes for your anxiety will depend on your symptoms and type of anxiety disorder. Each anxiety disorder has different symptoms, but Ken Duckworth, MD, the medical director for the National Alliance on Mental Illness and an assistant professor of psychiatry at Harvard Medical School in Boston, says many people with these disorders can benefit from this three-pronged approach: psychotherapy, exercise, and medication. Each person may need a different combination of these three elements, and in different orders. There's no magic in the treatment of anxiety, says Dr. Duckworth. Some people will get better with psychotherapy alone, while some people might need medication to help them concentrate better on the therapy. Anxiety and depression can decrease motivation to exercise, but medication may give you the energy to do it. Also, says Duckworth, a patient may need more than one medication. There are several types of medications used to treat anxiety disorders: antidepressants, benzodiazepines, buspirone, hydroxyzine, beta blockers. Within each of these categories, there are subgroups of drugs that work differently and have their own benefits, risks, and possible side effects. According to the American Academy of Family Physicians, antidepressants are often used as the first line of treatment. 1. SSRIs, or selective serotonin reuptake inhibitors in particular, are the kind of antidepressants that are most often prescribed. They help make serotonin, a neurotransmitter that helps maintain mood, become more available to the brain. These medications often take 6 to 8 weeks, or longer, to be fully effective. They're super effective in treating anxiety disorders, says Beth Salcedo, MD, Medical Director of the Ross Center for Anxiety and Related Disorders and Board President of the Anxiety and Depression Association of America. It's not known exactly how SSRIs work on serotonin to alleviate anxiety, says Dr. Salcedo, but what is known is that they're not addictive. It's important to follow your doctor's instructions when taking any prescription drug. Talk to your doctor if you're concerned about the side effects of a medication, or if the drug you're taking doesn't seem to be helping with your symptoms. Related, 5 exercises to nurture self-compassion. Which antidepressants are used for anxiety? The 2 most commonly used types of antidepressants for treating anxiety disorders are selective serotonin reuptake inhibitors, SSRIs, and serotonin norepinephrine reuptake inhibitors, SNRIs. Examples of SSRIs include Prozac or Serafin, fluoxetine, Celexa, citalopram, Zoloft, sertraline, Paxil, Paxiva, or Bristal, paroxetine, Lexapro, escitalopram. Examples of SNRIs include Effexor XR, venlafaxine, Cymbalta, duloxetine. Side effects of both SSRIs and SNRIs may include nausea, nervousness or restlessness, dizziness, reduced sexual desire, drowsiness, insomnia, weight gain or loss, headache, dry mouth, vomiting, diarrhea. Other antidepressants that may be prescribed for anxiety include Wellbutrin, Zepbound, Aplenzin, Budoprine, or Bupropion, bupropion. Tricyclic antidepressants, such as Amidid, Amitril, Elavil, or Endip, amitriptyline, Evenbel, Pamelor, nortriptyline, or tofranil, imipramine. Some people respond better to some antidepressants than others. You may need to try a few different medications before finding one that works for you. Related, meditation's soothing effects. Which benzodiazepines are used for anxiety? Benzodiazepines help relieve anxiety by enhancing the activity of a neurotransmitter in the brain and generating a sedative effect. They work quickly, and can often work within 1 hour or several hours. They are usually prescribed for those with generalized anxiety disorder, panic disorder, and social anxiety disorder. Because they work so quickly, and because people taking them can build up a tolerance that leaves them needing higher doses to feel better, doctors will prescribe them for very short periods of time, usually no more than a month. People can become addicted to benzodiazepines. If you stop taking them suddenly, withdrawal symptoms may occur, so it's important to follow your doctor's instructions for tapering off your medication. They can also be used with antidepressants, since anxiety and depression often coexist. in order to enhance the effects of both drugs. They're a powerful tool, says Duckworth, but you have to be really smart about their use. Commonly prescribed benzodiazepines include Xanax or Naravam, alprazolam, Klonopin, clonazepam, Ativan, lorazepam, Valium, diazepam. Other side effects of benzodiazepines may include drowsiness, dizziness, nausea, blurred vision, headache, confusion, tiredness/fatigue, nightmares.